All right, so have you ever felt like health insurance policies are like written in some kind of secret code that you can't quite crack?
Oh, yeah, absolutely. I think everyone feels that way sometimes.
Yeah. Well, today we're going to try to decode one of those policies, or at least one situation that really shows how much these policies can impact all of us.
Yeah, this one's a big one.
Okay, so remember that whole thing with Anthem Blue Cross Blue Shield trying to limit anesthesia coverage during surgery?
Honestly, I remember that.
Well, they ended up reversing that decision, but the story is actually way more interesting than just like a simple policy flip-flop.
Yeah, it really digs deep into some important aspects of healthcare, like balancing costs with quality of care.
Yeah, exactly. And even patient safety, which is huge.
Huge, yeah.
And to really unpack this, we've got like a whole stack of sources here.
Oh, wow.
Yeah. So we've got Anthem's announcements, like the initial one, and then the reversal. And then we've got reactions from medical professionals like the ASA. We've got news articles from People and Axios, and even some like pretty heated discussions we found on Reddit.
Oh, wow. So we're really getting like a 360 view on this.
Yeah, exactly. We're going deep.
Nice.
So this whole thing started in Connecticut, Missouri, and New York, but like, honestly, this has implications for everyone, no matter where you live.
Yeah, I think that's what makes it so interesting, right?
Exactly.
It's not just like an isolated thing.
Yeah.
No, it brings up some like really fundamental questions about healthcare. Like,
Oh, yeah, for sure. Like, how are these decisions even made?
right. And who has the power to decide,
Yeah.
what happens with your health?
Like, who gets to call the shots?
Exactly.
Yeah. Okay, so let's rewind back to the beginning.
Okay.
So Anthem announced this policy, and it was basically going to set these strict time limits on how long anesthesia would be covered during surgery.
Like you go in for a procedure and there's like a clock ticking
Yeah, literally.
on your coverage.
Yeah, and the thing is, like, after that predetermined time limit, coverage would be denied.
Like just cut off.
Pretty much, except for a few cases like maternity care or patients under 22.
Okay, so there were some exceptions.
Yeah, there were a few, but for the most part, it was like, time is up, coverage is done.
Wow.
I know, and the original effective date was supposed to be February 1st, 2025.
So not that far off.
No, not at all. But as soon as it was announced, there was like this huge backlash.
Oh, I bet, especially from anesthesiologists.
Oh, yeah, they were furious. I mean, understandably.
Yeah, because they were the ones who would be like right in the middle of that.
Exactly.
Yeah.
They were arguing that setting these arbitrary time limits is not only impractical, but it could actually be dangerous.
Yeah, because like how can you predict exactly how long a surgery is going to take?
Right. Every patient is different. Every surgery has its own, like, quirks and complications can come up out of nowhere.
Yeah, like you never know what's going to happen once they open someone up.
Exactly. Trying to, like, squeeze complex medical care into some preset time slot, it just doesn't make sense.
No, not from a medical standpoint at all.
Oh, yeah. And the American Society of Anesthesiologists, the ASA, they were, like, really vocal about this.
Yeah, they did not hold back.
They were calling for an immediate reversal of this policy, and they were really emphasizing that anesthesiologists are there to manage the patient's well-being during the entire procedure.
Not just like for a set amount of time.
Right, exactly. It's about individual care.
Yeah.
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 Responding to the patient's needs in real time.
Yeah, making sure the patient is safe and stable throughout the whole thing.
Exactly. And the ASA didn't mince words either. They were pretty blunt in their criticism.
I bet.
Yeah, there's this one quote in a People article where they call these time limits arbitrary, and they point out how this could actually hurt patients.
That's a powerful statement.
Oh, yeah, and there's this one story I saw on Reddit. This user needs frequent surgeries.
Okay.
And they were understandably terrified about what this policy would mean for them.
Yeah, like their health was literally on the line.
I know, and when the policy was reversed, the relief they expressed was like, you could just feel it through the screen.
It's like these human stories behind the headlines.
Exactly, and it really shows you why we need to pay attention to these kinds of decisions.
Oh, yeah, absolutely.
Okay, so we get why the doctors were outraged.
Right.
But what was Anthem even thinking? Like, what was their reasoning for this policy in the first place?
Well, in their initial statement, they were saying it was all about affordability and preventing what they called overbilling for these anesthesia services.
Like they were trying to make healthcare more manageable, I guess.
Yeah, they wanted to rein in those costs,
But is cutting coverage really the way to do that?
especially for something as crucial as anesthesia during surgery.
Yeah, I mean, that's a pretty vital part of the whole process.
Definitely something doesn't sit right about that approach.
No, it feels like they're cutting corners in a really dangerous way.
I agree. And to get a clearer picture of their logic, we have to like dig into how anesthesia billing actually works.
Okay, so how does that work?
Well, the Axios article pointed out that Anthem might be basing these time limits on like average surgery times.
Average surgery times.
Yeah.
Where are they getting those numbers from?
Well, it seems like they're getting them from the Centers for Medicare and Medicaid Services.
Yeah.
Exactly, CMS.
Okay, so they're taking these broad averages and applying them to individual patients.
Without taking into account the specific circumstances of each surgery.
Like every surgery is different.
Exactly.
That just seems like a recipe for disaster.
It raises concerns for sure. Like, are they oversimplifying things just to save money?
And potentially putting patients at risk.
Yeah, it's a scary thought.
And you know what really makes this whole thing even more frustrating?
What's that?
So after all this backlash, Anthem reverses the policy.
Okay.
And they claim there was all this widespread misinformation about their intentions.
The misinformation defense.
Right. It's like, are they serious?
It's a classic.
Like, what misinformation are you even talking about?
Right, like, were we all just misinterpreting this perfectly clear policy?
It feels like they're trying to gaslight us.
A little bit.
Okay, so let's break down their reversal statement for a second.
Okay, let's do it.
They're saying that they would never deny medically necessary anesthesia.
Okay, but here's the problem with that.
Yeah.
That directly contradicts what their initial policy said.
Which explicitly stated coverage denials after a certain time limit.
Yeah, it does really add up.
No, not at all. And it makes you wonder, like, what does medically necessary even mean to them?
Right, because that's a pretty subjective term.
Totally. And it's like, if they were so committed to covering necessary care, why even propose such a rigid and controversial policy in the first place?
That's the million-dollar question.
I think the reality is all the pressure they were getting from everyone, the ASA state officials, even that Reddit thread we talked about.
Yeah, all that public outcry.
It probably forced their hand.
I think you're right. They couldn't ignore it anymore.
Speaking of state officials, the People article highlighted how New York Governor Kathy Hochul and Connecticut Controller Sean Scanlon,
Okay.
they basically called out this policy right away and demanded that it be reversed.
Wow, so they took swift action.
Oh yeah, they were not messing around. Hochul called the policy misguided, and Scanlon said he was pleased when Anthem backed down.
They were feeling the heat, for sure.
Definitely. But it brings up a question that I've been thinking about.
Okay, what's that?
We know the policy was reversed in Connecticut and New York, but what about Missouri?
Yeah, what's going on there?
Our sources haven't really said anything about what happened in Missouri.
That's a good point, and unfortunately, we don't have the full picture on that yet.
It's like a missing piece of the puzzle.
But it does highlight how important it is to stay informed about what's happening with healthcare policies.
Especially in your own state.
Absolutely, because these decisions can have a real impact on your life.
Yeah, even if you don't live in one of those specific states or have Anthem as your insurer.
Right. This whole situation has implications for everyone.
It shows how interconnected everything is.
And how important it is to be aware of what's going on.
Exactly, because it could affect you even if you don't realize it.
Absolutely.
Yeah.
And it's not just about being informed.
It's about taking action, too.
Exactly. Using that knowledge to make a difference.
Yeah, and that's what we're going to talk about next.
Okay, I'm ready.
So stay tuned. So this whole Anthem thing, it really makes you think about how health insurance isn't just like some abstract concept, you know?
Oh, yeah, totally.
It's about real people making decisions that affect our lives, our health.
Our wallets, even.
Exactly. And this one policy, it really shows that.
It definitely brings to light that sometimes contentious relationship between, healthcare providers.
Insurance companies.
Yeah, and then the patients.
Caught in the middle.
Right.
It's like we're all in this tug of war.
Yeah, I like that analogy.
Doctors want to provide the best care possible for you. Insurers are like focused on the bottom line.
And patients are stuck trying to figure out this complicated system.
And worrying about whether they can even afford the treatment they need.
It's a tough spot to be in, for sure.
And it makes you think, like, how do we balance the need for affordable health care with making sure everyone gets the treatment they need?
That's the million-dollar question right there.
It is. It really is. And it's a dilemma that lawmakers are constantly grappling with.
Oh, yeah, for sure.
But it's also something that we as patients and citizens need to be thinking about.
Absolutely. We need to be engaged in this conversation.
Yeah, and this Anthem situation, it shows that we have a voice and that it can actually make a difference.
It definitely does. We
Yeah.
saw how all that pushback from doctors and patients,
State officials even.
yeah, it forced Anthem to change course.
It's a powerful reminder that we're not powerless.
No, we have more influence than we think.
It's like that saying, the squeaky wheel gets the grease.
Exactly.
Yeah.
Sometimes you got to make some noise to get people to listen.
And sometimes you have to know how to squeak effectively.
Yeah, that's where being an informed healthcare consumer comes in.
Like, it's not just about understanding your own insurance policy.
Right. It's about staying on top of proposed changes.
Knowing your rights.
being proactive,
Right.
advocating for yourself and others.
It's like we spend so much time researching what kind of car to buy or what new phone to get.
But then when it comes to health insurance, this massive document that affects so much of our lives.
We just kind of skim it and file it away.
That's such a good point. We should be applying that same level of scrutiny to our healthcare choices.
And luckily, there are resources out there to help us navigate this crazy world.
Oh yeah, definitely. There are patient advocates, online resources.
Even your state's insurance department can help.
It's like having a cheat sheet for the healthcare system.
Exactly. And don't be afraid to use it. Ask questions. Challenge assumptions. Speak up when something seems off.
Don't just accept things as they are.
Because as we saw with this Anthem situation, change is possible when people come together and demand better.
And it's not just about complaining or criticizing.
It's about having those constructive conversations.
Exploring different solutions, working together to make the healthcare system work better for everyone.
Yeah, instead of just pulling on the rope in opposite directions. Maybe we can figure out how to move forward together.
I love that image.
Yeah.
And it really speaks to the idea that healthcare isn't a zero-sum game.
It's not about winners and losers.
It's about finding solutions that work for everyone. Patients, providers.
Even insurance companies.
Yeah, everyone has a stake in this.
So how do we even begin to approach such a complex issue?
It's a big question for sure.
Where do we start?
Well, I think a good first step is to shift our perspective a little bit.
Okay. How so?
Instead of feeling overwhelmed and powerless, let's recognize that we each have a role to play in shaping the future of healthcare.
So like reframing it as an opportunity instead of a burden.
Exactly.
I like that. But what does that look like in practice? Like what can we actually do?
Well, it can be as simple as having conversations with your friends and family.
Sharing your experiences, educating yourself about the issues.
Exactly, and getting involved in your local community.
Supporting organizations that are fighting for healthcare access.
Contacting your elected officials to voice your concerns.
Hey, maybe even run for office yourself.
Now you're talking. But seriously, there are so many ways to get involved.
The key is to find something that speaks to you.
And take that first step.
And remember, you don't have to do it alone.
There's power in numbers.
Connect with people who share your passion. Build coalitions, amplify your voices together.
Because that's how we create real lasting change.
By working together, refusing to be silent, and demanding a healthcare system that puts people before profits.
I love that idea of collective responsibility.
It acknowledges that we're all interconnected.
And that we need to work together to create a system that benefits us all.
So instead of just being passive recipients of healthcare,
We could become active participants in shaping the system.
I like that. And it brings up an interesting question that I've been thinking about.
Okay, I'm all ears. What's on your mind?
Okay, so we've been talking about this whole Anthem situation
Yeah.
and how it shows the power dynamics in our healthcare system.
Yeah, like these huge insurance companies
With tons of resources and influence.
making decisions that affect millions of people.
And then there's us, the patients, just trying to like figure out what's going on.
Yeah, trying to decipher those
We
policies.
navigate that whole bureaucratic maze.
It can feel pretty overwhelming, honestly.
Oh, it totally can. You feel so small and insignificant up against these big corporations.
But the thing is, the Anthem reversal, it shows that we can make a difference.
Yeah, even when the odds seem stacked against us.
It's like David and Goliath.
Except David is like a whole bunch of people,
Doctors, patients, state officials,
all teaming up to take on this giant insurance company.
and they won.
It proves that collective action works.
We don't have to just accept things as they are.
We can push back, demand, better hold those in power accountable.
Absolutely.
Okay, so let's say someone's listening to this and they're like fired up, ready to get involved.
Okay, I love that.
But they're like, I don't even know where to start.
I get that it can feel like a big, confusing world.
So what advice would you give them?
First of all, that passion is amazing. That's what we need. And the good news is there's so many ways to get involved.
Even if you're not a doctor or a policy expert.
Exactly, you don't need any special credentials.
So like, what are some examples
Well, you could look into local organizations in your community.
that are advocating for healthcare access?
Yeah, there are groups focused on all sorts of issues like affordable medications, mental health services.
Support for chronic illnesses.
It really runs the gamut.
And even if you don't have time to volunteer, you can donate.
Or spread the word on social media.
Yeah, every little bit counts.
Absolutely.
Another way to make your voice heard is to contact your elected officials.
Let them know what you care about.
Share your concerns.
They do pay attention to that kind of stuff.
And hey, if you're feeling really ambitious,
Okay, I like where this is going.
maybe run for office yourself.
There you go. Lead the charge for healthcare reform.
But seriously, there are so many ways to get involved.
It's about finding what resonates with you.
And taking that first step.
And remember, you don't have to do it alone.
Find your people, build coalitions, amplify your voices together.
That's how we create real, lasting change.
By working together, refusing to be silent, and demanding a healthcare system that puts people first.
Well said. I couldn't agree more.
So as we wrap up this deep dive, I want to leave you with one final thought.
Okay, hit me with it.
We've been talking about insurance policies, power dynamics getting involved.
Yeah, been a lot.
But it all comes down to this.
Okay.
How much do you really know about how healthcare decisions are made in your own backyard?
That's a great question. It's easy to get caught up in the national stuff.
But real change starts at the local level.
Exactly.
Have you ever looked into how your state legislature handles healthcare bills?
Do you know who your representatives are on those health committees?
What about local advocacy groups?
Those are all good things to look into.
It's like we focus on the big scary monster in the distance, but forget to check for the little monsters right under our noses.
It's easy to do.
So my challenge to you, the listener, is to take this deep dive a step further.
Don't just listen to us.
Do some research, get involved.
Be a part of shaping the future of healthcare in your community.
Because ultimately, it's our responsibility to create a healthcare system that works for everyone.
Not just a select few.
And it starts right where you are.
Well said. I think that's a perfect note to end on.
Thanks for joining us on this deep dive into the crazy world of health insurance.
It's been a pleasure chatting with you.
And remember, knowledge is power.
But action is where that power comes to life.